This is part 4 of the lecture on the evaluation and identification of children with suspected disabilities. My name is Dr. George Giuliani from Hofstra University, and we left off the last lecture talking about the evaluation standards under the federal law when you're doing the evaluation of a child for suspected disability. And we talked about the first 3 standards so far. We have talked about the multidisciplinary team. We've talked about testing not having racial or culturally discrimination and bias within it. And we talked about validity and reliability. Now we go to standard number 4. And standard number 4 says that tests and other evaluation materials must be administered by trained personnel in conformance with the instructions provided by their producer. Okay, let's break this thing down. Let's break this evaluation down. Tests and other evaluation materials must be administered by trained personnel. Trained personnel. What we're talking about here is that the people who are administering the evaluations, the people doing the evaluations, have to be qualified to do so. The law says that when we do the evaluation of a child for a suspected disability, it has to be done by a multidisciplinary team. But the people on the team have to be qualified to administer what it is that they are doing. So, for example, if I'm a psychologist, I should be administering psychological tests, not measuring speech and language evaluations or performing speech and language evaluations. If I'm a special education teacher on the multidisciplinary team, I should be doing the educational evaluations, not doing physical therapy evaluations or intelligence quotient evaluations. The point being is that the tests and other evaluation materials have to be administered by trained personnel. People have to be qualified to do what it is that they're doing. So the fact that you have a multidisciplinary team isn't enough. It's that the people on the team are actually doing what it is that they're qualified to do. The second part of this standard says that all of these things must be done in conformance with the instructions provided by their producer. In conformance with the instructions provided by their producer. This means that we have to make sure that we are following the manual. We don't just give the test the way we feel like doing it. We have to administer the test the way it's supposed to be administered. And all norm reference tests, all types of testing, have to be administered the way in which everybody should receive them. And that becomes very important because what we want to be sure is that everybody gets the test administered in the same way. Everybody gets the test graded in the same way. Everybody gets the results reported in the same way. And this is a concept known as standardization. You may have heard of this term before, standardization. So the idea behind evaluation standard number 4 is that all the tests have to be administered by trained personnel, so they have to be qualified, and they have to be done the way in which they're supposed to be given. The manuals for each of one of these tests tell us how to do it. And so they must be administered in conformance with the instructions provided by their producer, the test producer here. Evaluation standard number 5 says that no single procedure can be used as the sole criterion for determining an appropriate educational program for a child. In a sense, the assessment must be sufficiently comprehensive and use a variety of tools and strategies to gather relevant information on the child. What we're talking about here is that no one thing can be used as the sole criterion for determining anything regarding the educational program for a child. It's the idea that many different things, many different procedures, many different tools have to be used before we can make a determination about whether or not a child has a disability and meets the eligibility criteria for special education. And so the extent of the evaluation performed is dependent on the suspected disability of the child. And all areas related to a suspected disability have to be assessed, including, if appropriate, health, vision, hearing, social emotional status, general intelligence, academic performance, communication status, and motor abilities. The idea behind evaluation standard number 5 is that we have to do a comprehensive assessment. No one thing is going to determine anything when it comes to special education eligibility. And so the law says that the evaluation that we do for a child in order to determine eligibility has to be comprehensive in nature. So what are the components of a comprehensive evaluation? Well, when you look at them, They are as follows. First, there's going to be an individual psychological evaluation, including general intelligence, instructional needs, learning strengths and weaknesses, and social emotional dynamics. Next, there'll be a thorough developmental, social, and academic history based on interviews with parents and students. This is also known as the intake. We do the intake. There's going to be a physical exam, including specific assessments that relate to vision, hearing, and health. We'll have many different classroom observations of students in his or her current educational settings. And when you do the observation of students in many different settings, that is also known as an ecological assessment, There'll also be an appropriate educational evaluation where we'll assess reading, writing, math, spelling, and all the different areas of education. We'll have behavioral assessments to see how the child's behavior compares to the norms for his or her age groups. Speech and language evaluations will be done so we can assess the speech abilities of the student and the language abilities of the student. When appropriate, physical and/or occupational therapy evaluations when it's going to be appropriate. There'll be portfolio assessments where we'll look at the work samples of the student to see the work and see how the student performs. And there'll be interviews with the teachers, the students, the parents, and any other significant others in his or her life. So, when we talk about evaluation standard number 5, we are talking about the idea that the evaluation has to be comprehensive in nature, that no one thing is going to determine anything. We have to look at all different facets, all different things being done. And once we look at the comprehensive assessment, once we look at the comprehensive nature of the evaluation, then and only then can we determine whether or not a child is eligible for special education and related services. Evaluation standard number 6 is as follows. When doing the evaluation, all tests have to be administered in the child's native language, and all reports have to be written in the parent's native language. So again, when we do an evaluation of a child for a suspected disability, all the tests have to be in the child's native language, and all the reports have to be written in the parent's native language. There are no exceptions to the rule on that. Now, once we do the evaluation process, once it's completed by the multidisciplinary team, an eligibility committee will meet to discuss the results of the evaluation and the school's recommendation. And according to the law, every public school district is required to have an eligibility committee. In New York State, this eligibility committee is called the Committee on Special Education. But eligibility committees are responsible for the identification of children with disabilities within the district and recommending appropriate education at public expense for the student identified as having disabilities. So after the multidisciplinary team does what it needs to do, after it does the comprehensive assessment, the eligibility committee will get together, they will meet, and determine whether or not the child is eligible for special education and related services. Once the eligibility committee meets and determines the child is a child with a disability and will receive special ed, we have to put together what's called an IEP, an individualized education program for the child, and the IEP team puts this together. And the IEP team will have 30 days to get the IEP completed once the parent consents to the special education services. So once the eligibility committee meets, once the eligibility committee comes together and the parent agrees that the child is a child with a disability, the team has 30 days to have an IEP completed. And lastly, if the child is identified as a student in special education and will receive special education services, we will have an annual review. Every year we'll have an annual review to discuss the progress of the student's goals. And then every 3 years, if the child is receiving special ed, we'll do a full comprehensive assessment all over again, and this is known as a triennial review. So again, at the end of every year, we'll have an annual review for a student receiving special ed and related services, and at the end of every 3 years, the child will be completely reevaluated. We'll have a full comprehensive assessment done once again, and this is known as a triennial review. This ends the lecture on the evaluation and identification of children with suspected disabilities, and we are now done with this lecture and topic.